Good morning. This is the clerk, and this is a courtesy announcement that we are now broadcasting live on the internet.
Good morning, Ms. Ayala. Would you like to do a mic check?
Good morning.
Thank you. Good morning, Ms. Marcello. Would you like to do a microphone check?
Good morning. Thank you.
Thank you very much. Good morning, Ms. Wapensky. Would you like to do a microphone check?
Good morning, Michelle. How's this?
Yes, very good. Thank you.
Thank you.
Hello, Vice Chairperson Wasserman. Would you like to do a microphone check?
Mike.
Thank you.
Thank you.
Good morning, President Wasserman.
Good morning, Vice President, Chair.
It's 9:57. We will get started promptly at 10 a.m.
Hello, Ms. Jordan. Would you like to do a microphone check?
Yes, good morning, everyone. Dr. Jordan with the Medical Examiner Coroner's Office.
Thank you, Dr. Jordan.
Good morning, Doctor.
Hello, Mr. Aguirre. Would you like to do a microphone check?
Yep. Good morning. Thank you.
Good morning. Good morning, Ms. O'Neill. Would you like to do a microphone check?
Yes, thank you. Good morning and happy holidays, everyone.
Thank you very much. Good morning, Captain Oberdorfer. Would you like to do a microphone check?
Yes, please. Good morning, all.
Thank you. Hello, Ms. Caballero. Would you like to do a microphone check?
Good morning.
Good morning. Thank you. Hello, Mr. Silve. Would you like to do a microphone check?
Thank you. Good morning.
Thank you very much. Good morning to you too.
Why, if you mark something as spam and block the sender, does it still show up in your emails, but with a red circle?
It's kind of like, how many licks does it take to get to the center of a Tootsie Pop? The world may never know, Supervisor.
Thank you, Kate. That's true.
Casey, the number of things that you are expert in just continues to amaze me.
Well, that's why I'm here. I have a lot of brain space dedicated to lyrics from 80s songs. So should we ever have a trivia time, if there's an 80s category, make sure to invite me on your team.
Good
Thank you.
to know. I may even challenge you there.
We might need an example right here in this meeting.
Ooh.
Yeah, but it's
One-
9:59, so here we go.
Right.
My brain needs a defrag.
All right, Chairperson
All right.
Ellenberg, it's 10 o'clock.
Recording in progress.
The recording, and we are ready for you.
Thank you very much, Camille, and good morning, everyone. Welcome to this final Public Safety and Justice Committee meeting of 2022, calling to order at 10 a.m. on, what is it, December 8th? Thank you. Let's start with a roll call, please.
Okay. Vice Chairperson Wasserman
Here.
and Chairperson Ellenberg.
I am here as well. We'll move into public comment. That's the portion of the agenda set aside for members of the public wishing to speak on items that are not on today's agenda, but are within the purview of the Public Safety and Justice Committee. Do we have any speakers, Camille?
Just give it a little bit.
Okay.
Looks like we don't have any requests to speak, Madam Chair.
Okay, then we will move to item 3, which is adoption of the consent calendar and changes to the agenda. And while, Supervisor Wasserman, would you like to start?
Thank you, Madam Chair. I'd move to approve item 17, and I would like to add for your consideration 6, 9, 10, and 15.
I'm with you on 9 and 10. I'd like to keep 6 on the regular agenda, but I would also offer items 11 and 14 to consent and request to hear items 5 and 12 together. So to make that a little bit less muddy, that would be items 9, 10, 11, and 14 on consent, 5 and 12 together. And did I miss something else of yours other than 6?
15, Madam Chair.
Let me take a look at 15, sorry. Just taking a quick look to see what I had to say there. I think that is fine to put 15 on as well.
Gotcha. So 9, 10, 11, 14, 15, 17 would be the motion.
Yes.
Thank you.
Hold on. That keeps 4, 5, and 12 together, 6, 7, 8, 13. I'm so sorry. I was sure that I had, I'm just double checking 15 one more time, please. Okay, that's fine. That's fine. So why don't you make that motion?
Motion made.
Okay, seconded. Do we have public speakers on the now voluminous consent calendar?
There are no requests to speak.
Thank you. And before we vote, I just want to extend a thank you to the staff that put so much work into preparing these reports. I certainly don't ever want consent to be perceived as a lack of interest, but in fact, the contrary, it often indicates that we have read the reports, don't have additional questions, and are very, very much appreciative of the work. So with that, let's take a vote.
Vice Chairperson Wasserman,
Aye.
Chairperson Ellenberg.
Yes.
Thank you.
Thank you so much. Item 4 is the ATI work group update. And for this item, we are joined by our contracted facilitators, the Resource Development Associates, who have an update for us on the progress of the ATI work groups. And I see that Martha has turned on her camera as well.
Yes,
Okay.
thank you, Supervisor. With us today is Megan Drasik from RDA Consulting, and she'll be providing the update today.
Thank you.
Thank you, Chairperson Ellenberg. Can everyone hear me okay? I've been having some audio. Okay, great. Thank you. Thanks for having me today. We have an update for you all on the progress through November 2022 with the ATI work groups. So we held our second sessions in the month of November. So as a reminder, that is with all 3 of our sub work groups. So that's intervention at the start, the criminal legal process, and re-entry. And so as part of that process, we did a little bit of pre-work and assigned some information gathering homework to the work group members prior to having these sessions. And so we asked work group members to gather background information or helpful context on each of the 3 focus areas that the work group members voted on in the month of October. And so with that, we were able to start our discussions with some background information and helpful context for everyone in the work groups. So during our work group sessions, in November, we also provided an updated timeline due to the pause that we had in October. And so that way work group members were aware of the session objectives that are coming up over the next few months. And so to recap that, we are completed with the November 2022 sessions where we focused on defining the issue. So I'll provide more information on that shortly. And we're currently in the process of working on the December 2022 ones where we're talking about gathering additional input and perspective. And so after the new year, we'll be spending 2 sessions with the work groups on developing strategies and recommendations. And then our final content generating session that we'll be doing will be focusing on considering policy and legislative changes and or funding needs related to recommendations that were developed. And so our main session objective for session 2, as I mentioned, was really defining the issue. So we wanted work group members to talk through what data requests they might have, what information they would need to better understand the issues that they're seeing in the different focus areas. So what we did was we had work group members split out into breakout rooms to have small group discussions on each of those focus areas that they discussed and voted on back in October. And because we were doing small group discussions, there were some work groups that had smaller numbers. And so RDA provided an option for those who had 5 or less members opt into a certain focus area group to reconsider whether they wanted to move forward with that focus area, really just due to recognizing that this is a lot of work and a lot of background information and research. Work outside of sessions has to go into those efforts. And so we wanted folks to feel like they had the ability to follow through on any discussions that they were having. So as a result of that option, 2 focus areas were either disbanded or merged with another group. So the criminal legal process group had a focus area related to agency collaboration and general practice improvement. So that focus area was not continued forward. And then the reentry group had a housing options that was merged with their services and opportunities available after release. So that one became one group. So now we have 3 groups in intervention at the start and 2 groups in criminal legal process and reentry. And so our discussion questions for those small group discussions really focus, like I said, on defining the issue. So you'll see we talked about the current state of the focus area in Santa Clara County, and then we had them discuss what else would you need to understand to better understand the issue so you could develop meaningful recommendations. And then we had them brainstorm what data is available related to those questions that you brainstormed and who has access to that data. And so following that discussion, we had them identify responsible parties or who could go out after the sessions and collect that data so we could bring it back to the group. So the plan is for work group members to continue gathering that data in our off time and bring it back so that we have that for the January and February sessions related to strategy and recommendation development. And so after we completed all 3 of those sessions with each of the work groups, RDA compiled a emerging themes document. It's fairly high level at this point, but you'll see that's table 3 in our written report that we submitted. And you'll see what's interesting. I provided some color coding so you can see if there's similar themes that are coming up across the different work groups. And what's interesting to point out is, although the themes and the issues might be similar and you're seeing them come up at different intercept points, the impact that they're having is very specific to each intercept point and where the work group members are discussing them. So for example, the green theme is really related to lack of capacity issues of community-based treatment and services that are impacting both intervention at the start. You'll see it in the criminal legal process. And although it's a similar issue theme and might have similar recommendations to help address, the impacts it's having at different intercept points along the justice system continuum is very specific to the work groups. So for example, the lack of community-based treatment might be an issue for alternative response programs when they're not able to connect someone before further justice system involvement, but it's also an issue for folks who have been booked and are waiting to be released to community-based treatment. So you'll see there's crossover, and we are keeping an eye on that and trying to come up with a plan to, as we're getting further and further down, make sure that we're not overlapping effort and our recommendations are aligned. And so, as I mentioned, we'll be almost done with our December sessions next week. And so those are focused on gathering additional input and perspective. So we're having work group members come up with community engagement plans and ways that they can bring in both additional stakeholders who are involved in the system, but then also community members for the additional input and perspective, especially for those who aren't involved in the work group itself. And so we'll provide a more detailed update on that next year when we have those plans completed. So with that, I'll pause. Are there any questions?
Megan, thank you so much. I appreciated the verbal report. The written was really fascinating. And one of the things that stands out to me is, although we are talking specifically about public safety and justice issues, this clearly encompasses work across the whole of the county. And being able to see it so clearly laid out already piques my interest about what kind of recommendations we're going to get to toward the end of this process. So thank you. Before going to the public, what I'd like to do is look to all of the folks on our virtual dais here, particularly any of you who sit on any of those committees, to see if there's anything that you would like to add. And raise your virtual hand or turn your camera on and wave at me. I'm not.
It's like, yeah.
Sorry. Okay. Thank you for being my extra eyes. Do we have any public speakers on this item?
We have one member of the public who wishes to speak, Madam Chair.
Terrific. Let's do 2 minutes, please, Camille.
Okay, please just give us a moment to get the timer up. Okay, and our next speaker is Paul Soto. I am unmuting you. You have 2 minutes to speak. The timer will begin when you begin speaking.
Good morning. My name is Paul Soto from the Horseshoe. That is an excellent observation that you made, Supervisor Ellenberg, because there has to be an integration of services. It can't be just public safety, lock them up, throw away the key. What we're dealing with, and all of these committees actually convolute this particular issue that I'm going to outline, is that it convolutes the fact that the war on drugs in the 1980s and the poly class, which was tried in this county, okay, created significant deficits in the reentry program. There was no reentry programs because this county didn't care. And what that did is it created deficits in detox beds, residential treatments, and THU placements. Because what this county was doing was using the prison system to lock them up and throw away the key. Remember, war on drugs? Well, I was a casualty of that war. I was a casualty. Okay, so you're not going to get anywhere in terms of progress until somebody boldly and courageously, and it's going to be at risk, political risk, that they start instituting the policy that allocates the funding, because this is a racial equity issue. This is absolutely a racial equity issue, that they start building capacity within the THUs so that Judge Manley has the capacity to place somebody, so that Gateway has the capacity to place somebody. If I want recovery, it's a racial equity issue that I have access to recovery immediately within 1 week. That's the goal. I want every citizen that wants recovery and wants treatment in this county to have access to that resource and service within 1 week, at least a detox bed. What that means is you're going to have to at least increase it by 10-fold. Detox facilities, residential treatments, and THU. Without that component, you will have no success.
And that concludes our speakers.
Thank you very much. We will move to item 5, which is the status of county diversion and ATI programs that we are hearing, along with item 12, which is the jail population who are incarcerated for 10 or fewer days. So why don't we do both presentations sequentially and then look to questions and comments.
Thank you, Chairperson. So I'm going to go ahead and present on item number 5. So my understanding is that this item will be moving quarterly. So this would be our last monthly report. I don't have any prepared slides. We submitted the legislative file, and certainly many of our partners are on this call if you had specific questions. So I thought I would leave it open to see, as I believe you requested last time, a minimal verbal report, and just to respond to questions as needed.
Thank you very much. Do any of the partners wish to make any additional comments? All right, then let's move to 12.
And I'll turn that over to Melanie Jimenez Perez, who is on the call, and she'll be leading that item.
Thank you, and thank you, Melanie.
Good morning, everyone. So Melanie Jimenez Perez, I'm a program manager in the Office of the County Executive. So at the request of Supervisor Ellenberg, since these items have been joined, we're going to just kind of quickly go through the data that has been presented. So if I working to get my screen up. Hopefully you can see that. So I will go through this quickly just to kind of let you know kind of some of the data enhancements that have been done. And it looks like that one's up and sharing. So I will go ahead. So the first one that we have been reporting on previously has been the monthly jail bookings. And this is just measuring data. So this is looking at per booking, per person, the highest charge based on how we categorize data. So that's why you have the gray bars, which are showing the total, and then the breakdown between felony and misdemeanors, which is represented by the orange and blue lines. So we're continuing to monitor the trends. We're seeing that there was a dip in November, and we're keeping an eye on the monthly jail population based on the information that the sheriff's office is providing to help us just take a look at what is happening in custody. There's the snapshot data again that has just looked at a moment in time over at 3 different points, and we see that all of the different areas that we have been monitoring are continuing to trend upward for those. This is a new data point that we've started looking at given the conversation at last Public Safety and Justice meeting. There was interest in looking specifically at those who remain in custody for 3 years or more and are unsentenced. And this came from the conversation because if you looked at the previous slide for November 15th, there were 159 people who had remained in custody. When we looked at the data on November 23rd, we were at 153. So what we've provided is a quick, just demographic look at who they are and kind of the duration of time that they've been in custody. As you see, a bulk of them have been in since 2017 or 2019. And then we've grouped generally the categories of the offenses that they are waiting in jail for on the far left. So you get a sense of what charge categories are, not their specific charges, but how we group them for reporting purposes. This one is always a little bit more challenging to untangle. What this is looking at are assisted release court orders. And this is sometimes in different areas been referred to as either the CAPS list or the JAC list or other treatment lists. What it is used when we're looking at the criminal justice data is the assisted releases. And that is because the information from the judges that's issued on a court order is provided to staff to track so that they're measuring if they are getting released or not. So we have a breakdown again on demographic data, and then also a sense of kind of which courtrooms or court departments they're coming from. And this is to help show that, you know, courts 60, 61, and 62 are commonly referred to as either our mental health or our collaborative courts. And those are the courtrooms who are really providing a bulk of the court orders. This data is just based on the data that's provided in court orders. So it won't align perfectly with what behavioral health is using because they are really involved on the treatment side. So overall, what we have seen are 84 individuals who on November 17th were waiting for release to services. And we know that of those, all 84 are looking for SUTS or mental health assistance. There's additional work that we want to do to be able to tease out the difference between kind of the general justice categories of outpatient, inpatient to more closely align with the behavioral health statistics, which reflect crisis, residential treatment, or THU placement, because this can be sometimes a little bit misleading because it's those who are looking for a bed and services. So inpatient is not necessarily an acute level of service. So as we look towards the quarterly report, we'll be working on giving some more detail into that, but we wanted to at least get it in front of the committee for discussion today. And one of the kind of wins that I want to point out is I know early in conversations about looking at how long people were remaining on the list, the average was closer to 30. What we looked at on November 17th was an average of 12.5. Yet when you look at it, there's always a couple of outliers who have remained for a long period of time. So the average person we're still looking at, it's between 10 and 12 days until they are released from jail after the court order, just looking at this snapshot in time. So next, when we come back in April, we'll have different data points to kind of see how we're progressing through that. So that is the last slide from the data dashboard. And just verbally, I'll go over the other one unless you would like also the presentation for item 12.
No, it's fine to do the verbal. Thank you.
So I just give you verbally. So what we looked at for those who were released within 10 days or less, we were looking to see, is there an overall trend? And the one thing that we have paid a lot of attention to within the criminal justice realm are getting people out who are going to be released. And by looking at the data, we saw that 80% of the people within the early months of 2022 were released within 3 days even. So we know that we're getting to them at an early stage. And the most common form of release was that jail site and release. So, kudos to the sheriff's office who was working on processing people and really aligning that. And that was because a lot of them are still being booked on misdemeanors. But one of the kind of areas that this left unexplored for us was, how can we now work with our additional criminal justice partners to find out, are they the same rotation of individuals? Are they our high system utilizers and have they been offered or connected to services? So as we move forward and kind of look to future data reports, we do want to have a more holistic view for this group. And we know that can only happen if we partner with our other criminal justice partners to learn more about these individuals. So now we've presented in the report kind of a look at who the population is. That's where we hope to take this, working with a data working group from many of the people who are on this call. So that's just overall kind of what we found to help tie up 2022. Thank you very much.
Thank you so much, Melanie. You mentioned a couple of times other law enforcement or other partners. Has something like this a presentation like this been made to perhaps the Police Chiefs Association or other similar groups beyond the county, so that we can begin to have sort of some shared understanding across the 15 cities in how we are responding?
There was one presentation during the pandemic to the Reentry Network group, and there was a lot of interest from the law enforcement community, because I think they share kind of the same concern. Are there these key people who we can really focus on and target? Right. And our district attorney's office has also shared, a desire to look at that. So that is definitely, I think, an area where we can, once we get a little bit deeper into the data, share it out more broadly.
That's terrific. Maybe we can plan even for the next quarterly report to either invite the chiefs to the PSJC meeting or talk about setting up a separate meeting and conversation for them. Thank you again for putting all of this information together. I think that providing it publicly really makes a significant difference in how transparent we are seeking to be, and it allows us to level set for ourselves at the county and for interested stakeholders where we are with these baseline statistics. And in fact, was shared with me that just last night, the ATI work group members, including some who are on this call today, were looking for information on how many people in jail are awaiting treatment. And my staff was able to point them to this very useful report. And it's encouraging. It's very encouraging to hear that people that don't need to be in jail for legal or safety reasons are being released into the community in a timely manner for the most part. And now that we're seeing that our system is beginning to work more efficiently in that regard, I'd be interested to learn more about what can be done about this high volume, exactly the population that you're talking about, this high volume of people that usually don't stay in jail for longer than 5 days, but keep landing back. As we think about the next quarterly report, what else do you think we should be considering about the needs of this population that cycles through the jail that, of course, could help us address recidivism and prioritize resources according to need? What other information might we need to get a handle on that?
One of the data points that I didn't highlight as much today, but is included in the 10 days or less report, is really looking at in 2017, so we want to look 5 years ago, those who were in for other drugs or misdemeanors was the most frequent charge. And then in 2022, it's misdemeanor driving under the influence. So we know that there is a substance nexus to some of these charges that I think is something that we as criminal justice partners can dig a little bit deeper into to look at. Are these the folks who are the priority really for service?
And what are the policies or funding decisions or things that we should be doing to try to prevent those in the first place, of course? And for the people that are awaiting placement on the assisted release list for over the average number of days, which I think was 12.5 from this sample, what are your thoughts there about what we might be doing to evaluate why they are staying on the list for longer, and with the intent again of coming up with solutions that might address this?
I would start with, just having the knowledge first is power. And I know our Deputy County Executive, Keeley, has been working with behavioral health to look at, in their monthly reports, if there's ways that they can also focus on that data point. Now that kind of we know what the baseline is, we know exactly who's beyond that. So I think it's something that Deputy County Executive Keeley will be bringing back with more information with behavioral health monthly reports on how they can prioritize that population.
And
Thanks.
Chair, if I may, we could also
Please.
invite back, if you would like. I spoke with Deputy County Executive Keeley, and we're happy to do a report back and invite behavioral health to PSJC to talk about those numbers in a little bit more detail. And it might be good to have a custody health and behavioral health joint presentation to talk about the strategies of how we're addressing the needs of our high utilizers. I think that they, as you know, present often at the board, but this is in particular to public safety and justice, and I think would be of great interest to many people on this committee.
Thank you. I think that's an excellent suggestion. I have just one more question, which I think if Judge McGowan is with us, I want to direct to the court, and then I'll look to other folks on the screen for their questions or comments.
Yes, I'm here.
Oh, hi, Judge McGowan. I'm wondering if are judges able to reevaluate their cases should a space in a different but equivalent program become available, or can they make more general referrals so that they're not limited to a specific service and the individual can go, to potentially a number of places that may meet their treatment needs? Or does it have to be place specific?
I'm not sure I know the answer to that. I know the judge can make the referral, but I don't know if they have the flexibility to make it so open-ended it's not to a specific place, but I will find out the answer.
Thank you so much. If you could share that either at our January meeting or in an off agenda email or letter to the board, that would be great. Thank you. Are there other comments? Public Defender O'Neill.
Thank you. Good morning. I just wanted to echo what Casey said, which is, I think it'd be really helpful to have behavioral health come in to talk about the placements. And I think in general, the higher the needs, the more expensive the placement and the fewer of them there are.
Mm-hmm.
So one other suggestion might be Judge Manley sometimes comes to reentry. He makes the majority of those referrals out of his department, so it might be interesting to hear from him. But for sure, behavioral health can do a great job explaining the number of available beds and the type that they are, because that's those people on the JAC list. Thanks.
Right. Thank you. And also often the higher the level of acuity, the less likely it is to be reimbursable by Medi-Cal. So that's another issue here. But I think clearly what we're talking about, and I can hear Judge Manley in my head saying capacity. We need to build or buy or contract for or otherwise secure more treatment beds, or we're going to stay in this cycle. And in order to expand the beds in the facilities, we of course also need to expand the workforce. So that to me is another place where a whole of county approach is what we need to really address this crisis. So thank you for that. Sylvia, were you just turning your camera on, or did you have a comment as well? No comment. Okay. Anybody else? Supervisor Wasserman.
Oh man, good stuff.
Do we have any public speakers on this item, Camille?
There is one request to speak.
Okay, 2 minutes, please.
Okay, please give us a moment to get the timer up. Our next speaker is Paul Soto. I am unmuting you. Please go ahead.
Yes, Paul Soto from the Horseshoe. Supervisor Ellenberg, I kept that article that was done in Spotlight that you and Judge Manley co-authored. We're not going to get any, we don't need any more data. We really don't, because that actually depersonalizes the issue. Okay, that's number one. Number two, it's a civil rights issue. It is against the law and the Constitution to keep anybody in jail that has not committed a crime. Remember, Michael Tyree was in county jail. He had not committed a crime. He was under Judge Manley's jurisdiction. He was released, but there was no bed space. And it actually resulted in the savage murder that this district attorney's office is going to have to try again. Okay, so this issue is going to keep coming up. Somebody was savagely murdered in the county jail because of lack of capacity. That's why Judge Manley's on it, and that's why I'm constantly on it. Now, I have a couple of investors right now. If I can plug you in, paulsoto2461@gmail.com. Just get a hold of me. I have investors right now. They got the bread. They need the connection and start relationship building with the county so that they can start opening up these spaces. And they don't just want to open up a drug recovery house, fill them up with a bunch of beds and collect money from the county. There's also a vocational component to it. Okay? And these are people that are serious about it. They don't know nothing, but they just have the capital. And so they're really interested in the work that I've been doing because of the consistency in which I do it. And also my life experience. The longest time that I stayed on that jack list, and this is no kidding, 45 days I was in jail after I was sentenced, before I was released to a recovery house. That is sickening in a society that has as its foundational document, the U.S. Constitution.
And that concludes our speakers.
Thank you very much. Item 6 is the 2023 Public Safety and Justice Ledge policies. I'm not going to ask for a presentation here. I'm going to hope and assume that everyone has had the opportunity to review the proposed policies and to weigh in. And if anyone would let me know if that is not the case.
Okay.
Then I'm going to proceed with a couple of comments on the documents. And is it Danielle? I'm looking to see who is taking, or Casey, is it you?
Yeah, Chair, I don't see Danielle or
Okay.
Steve Preminger, but I'm happy to take notes and respond to comments as best I can.
Perfect. Thank you so much. I'd like to offer a few amendments to update the policies, and then I'll offer a motion to approve this document with my updates. First, I'd like to request that our IGR group review the State Association of Counties Administration of Justice platform to look at elements that may be beneficial for our county to incorporate into our own. And I would be particularly interested in seeing the portion on trial court financing and facilities be incorporated, considering the system-wide challenges that we are facing stemming from underfunding of our own courts. Second, the county previously undertook an arduous and impressive process to craft legislative recommendations through the bail and release work group, which was led by retired Judge Cordell. There's an entire section of that report dedicated to state legislative changes that I would also ask our IGR team to review and consider incorporation into our platform wherever they deem appropriate. Third, my office has been in communication with county administration and the Behavioral Health Services Department regarding numerous advocacy points around 988 and the mobile crisis response. I understand that more information on proposed direction is expected in January. So I just want to put that on the IGR team's radar, that those amendments will be forthcoming. And it might be something that we want to add later. Fourth, in different places in the document, alternatives to incarceration and diversions are mentioned. And I would like to ask that of the many policies in our PSJC chapter, that we prioritize advocacy for legislation that supports expanded alternatives to incarceration, restorative justice approaches, and approaches that address the racial inequities that have been over time orchestrated by the criminal legal system. And lastly, I believe it would reflect the position of the board to add support for policies that increase public transparency and accountability of law enforcement, as well as the criminal legal system more broadly. So those are a few specific changes and a few requests that they consider for incorporation, and that's my motion.
Thank you so much. I've taken these
Excuse
notes.
me, Supervisor Ellenberg.
Oh, you're here.
I was promoted to panelist, so I heard all your comments. Thank you very much.
Thank you, Danielle.
And I'll review the document and make the changes requested before the full document goes back to the board, and perhaps I'll connect with your staff just to make sure that I'm hitting the target on the mark.
Perfect. Thank you so much, Danielle. Glad you're here. And thank you, Casey, for pinch hitting. Supervisor Wasserman, would you be willing to second my motion?
Yes, I just didn't want to interrupt the dialogue. Absolutely.
Thank you very much. Do we have any other comments on proposed amendments to this document? Looking. I'm so excited to be back in person with all of you in January, I have to say. Do we have any public speakers, Camille, on this item?
We do have one request to speak.
All right, 2 minutes, please.
Okay, 1 minute. Okay. Our next speaker is Paul Soto. I'm unmuting you. Please go ahead.
Thank you, Supervisor Ellenberg. That's what I needed to hear, is that there has to be a racial equity component. And this is what racial equity actually means. It's not just a theoretical kind of aspiration that you would have maybe for a nonprofit's mission statement. It's an actually legally binding principle. It really is. And here's why it's a legally binding principle, is that our public health official, Ms. Cody, went on stage and gave a speech. In that speech, she stated, and I quote, "Racism is a public health issue," end quote. With that statement made by a county official at her level, that gave me all the justification that I need to continue to push that, because it is a public health issue. So I want this on par with the kind of medical treatment and medical funding that goes to VMC. I mean, it's very simple. Either that or she was just conning me. She was just thinking that I'm a fool and I don't know how to put these pieces together. I think I've probably proven that I do. So and this is what it looks like, okay? That's how it's defined, but this is how it looks. Is that you just cut services to other programs and you start allocating money here. Racial equity funding, budgeting, does not mean, oh, well, if we have something left over after we paid for everything else, then we use this money, put the racial equity label on it and say that we've met the racial equity responsibility of the county. No, chale, it doesn't work that way. The way that it works is you cut from other programs and you install here because the principles of racial equity trump all others. Why? Because it is a principle that has morality to it, and according to Cody, it's a public health issue.
And that concludes our speakers.
Thank you very much. Item 7 is the 2021 juvenile arrest and probation data. Do we have Chief Garnett?
We have Assistant Chief Burchard here today.
Just as good. Hi, Chief Burchard. Good to see you.
Good to see you. Good morning, Chairperson Ellenberg and Vice Chair. Mr. Wasserman. Today presenting is Craig Carpenter, our Program Manager over Research and Development, and we're here to answer questions when you're done.
Great. Welcome, Craig.
Good morning. Thank you. I'm going to share my screen and proceed through the presentation, and then I'd like to move on and give you a quick preview of some new dashboards at the end of this, which we're very excited about. So since at least 2014, the Probation Department has worked with other system partners to publish an annual written report, which is posted to the probation website. Most recent version available there covers data from 2020, and it's a document that's actually close to 150 pages long. So it became bigger and bigger over time. For 2021, instead of releasing that similar format report, we've been working on a new project to make much of the same data accessible to the public through data dashboards. So these new dashboards are going to include arrest and citation data, information on youth demographics, detention figures, as well as different factors that contribute to youth's legal issues. So while these dashboards are in development, we put together what we're calling a data book, which is a presentation I'll run through today. And it outlines some of the important juvenile justice data elements that would usually go into the traditional annual report. So I won't explain all the figures in this data book, but I do want to just run through it and highlight some of the high-level trends, beginning with arrests and citations, and then, as I said, briefly move on to show you the dashboard. So at the bottom of this slide here, you can see we've got an overview of arrests and citations by year since 2017. So the bars count all arrests and citations. So if a single youth is referred to probation more than once during the year, they're counted more than once, but the line is a count of unduplicated youth. You can see numbers have declined over time with a more substantial decrease in 2020, obviously COVID-19 at that point, and the trend really continued into 2021, even as the COVID-19 restrictions eased. So if we take a look across the last 5 years, and these are kind of 3 key data points for us, you can see declining trends across all of them. So arrests and citations decreased 34% compared to 2020. Referrals to juvenile hall decreased 30% compared to 2020, and admissions to juvenile hall decreased 32% compared to 2020. And this is not unique to our county. I should say that statewide trends in juvenile arrests have decreased almost 25% in 2021 compared to 2020, and 40% in 2020 compared to 2019. So to move on, this slide shows you the breakdown in offense categories. So in 2021, arrests for property crimes decreased notably by 55%. Drug and alcohol related offenses decreased by 40%. Some of these categories, people often ask what's included in other crimes. So these include offenses such as obstruction, conspiracy, driving while unlicensed, and other crimes against people. Category includes things such as PC 242 battery, violation of DV court orders, etc. So I'm going to move on to offense classifications. I'm going to touch on very briefly to say that felonies have increased as a proportion of all offenses. In 2021, they accounted for 47% of all arrests compared to 42% in 2020. But the actual total number, obviously, as everything has shrunk in 2021, felonies have decreased by 26%. There's always a lot of interest in where the young people who are arrested or cited live. So this slide shows you the home address, cities, and zip codes for youth arrested or cited through the year. Felonies on top, misdemeanors at the bottom. You can see, understandably, that San Jose accounts for the greatest share. This next slide shows you the breakdown of offense level for the top 10 cities on top, and then at the bottom, specifically looking at South County cities. So you can see Gilroy in the dark blue, Morgan Hill, and San Martin. Moving on a little bit more into the demographic side of things, this breakdown by offense on top shows you that youth aged 16 and 17 accounted for the largest share of all offense categories. And at the bottom, 57% of youth who were arrested or cited through the year were aged 16 or 17, 26%, 14 or 15, 10% were 18 and up. Moving on to gender, 78% of the youth arrested or cited through the year identified as male, and 22% identified as female. Race and ethnicity continues to be a challenge that we are investing a lot of time and energy into. You can see here that 66% of the youth arrested or cited through the year identified as Latino, 14% as white, 8% as Black, 6% other and multiracial, and 5% Asian and Pacific Islander. So here we move away a little bit from the youth arrested or cited through the year to look at youth who are on probation across 2021. So these final slides just highlight some results from the Juvenile Assessment and Intervention System, or JACE as we call it, which is a gender-specific assessment tool that identifies recidivism risk, criminogenic needs, or really those are the needs that contribute to the youth's legal issues. So first, at the bottom of the slide, you can see that just under half of the boys assessed scored as low risk. High risk accounted for a smaller share, 15% for boys and 11% for girls. And the following slides just break down the top needs for, this slide is for male youth and then proceeds to female youth. Next one. So here you can see emotional factors had the highest percentage at 67%, relationships and substance use. So these things are really used as a guide in case planning for youth to respond to their needs and to match services to them. This final slide is a quick summary that summarizes everything else really in the presentation. So at this point, I'm going to stop sharing this one and switch over to show you the new dashboards. Okay, hopefully you now see a web page with a dashboard. This is not the final view. So they're still in development. They will be published on the website. It'll look similar to other county pages where it's going to be a Microsoft Power BI dashboard embedded into a web page. We started by building out 2 pages. The first being arrest and citations, which is here where we've landed. So just to quickly orient you to the page, you can see it. We've got data available all the way back to 2016. When a member of the public accesses the page, it will land here to show the most recent 3 years in this view. And it's really a summary of arrest and citation trends. So you can hover over any data point, it'll give you the data labels. That way you can select a specific year, you can compare year over year, and it's really going to be a lot quicker. They'll be updated monthly, so rather than people having to wait to the end of the year for a report to be published on the site, people will be able to dip into this data as and when they like. So the second page available covers demographics. This one is quarter based rather than years, so it's a little bit more granular. Users can select and compare quarters. It will default to the most recent full quarter. So obviously Q4 is still underway, so that is not going to be a full quarter's worth of data. You'll see percentages nested here within the bars for race and ethnicity, school district information. And like I said, these are kind of our starting point. So these are the 2 initial pages. It's been a big effort from our IT group to get this up and going. They're going to be published in the new year. And then once these are up and running, the plan is to add more. So it'll be detention data and more detailed information, which should really make it a lot easier for the public to see progress and what's happening throughout the year. with that, I will be happy to take questions.
Thank you so much, Craig. Can you stop sharing your screen so we can see everybody?
Yeah.
Thank you. I really just sincerely want to applaud the probation department for really this exemplary initiative in establishing your data dashboard, as well as for the comprehensiveness of your annual report. I would be very interested, and Casey, I'm looking at you on my screen here, to see similar reporting from all county departments in one aggregated place that stakeholders and members of the public can easily address. I know that my office has reached out to the county's open data portal lead to see how the data can be made available both on the probation department's website and the county's centralized location for departmental data reporting. I was also really impressed by how the juvenile assessment tool facilitates efficient and continuous evaluation of the criminogenic needs at the individual and the population level, and appreciated the very clear reporting on the distinct data sets. Chief Burchard, can you speak to how we might use that data to better align the juvenile services that we provide to the needs that have been identified?
Yeah, I think so the principal service needs that you saw there and briefly touched on that really drives our case plans for youth and addressing the criminogenic needs. Working with our stakeholders here, that allows us to really prioritize and individualize the services for each youth. That's really where the efforts come in and impacting recidivism and keeping youth out of our system. There's so many on this meeting and call who've been a part of this process for so many years, and I just think that we're just showing the fruits of all the efforts of everybody here and being as transparent, because if we're going to make that impact, it has to be transparent. We all have to be a part of this work. I mean, it just doesn't get done in silos. So it's really impressive, and our RAD team and the work that they do to keep this information gathered from everybody really here on this call. So it's really good work.
Yeah, it is. And we really should be looking to this when we think about prevention and early intervention for kids, so that they never hit our system in the first place. So really, thank you. Also, the ATI work groups have spoken several times about looking more closely at the practices in the juvenile system to see what reforms might be beneficial to bring to the adult side, which has long been my position as well. And I'm wondering, either for Craig or Nick, would this tool be appropriate for use on the adult side?
Go ahead, Mario.
I was going to say, we use the JACE, and on the adult side, both the jail and probation and I believe the trial use the case. So we do use it's a tool that is normed for each population appropriately, and they're both tools are gender specific. So we actually already do use the case for adult offenders.
And thank you for that, Mariel. And do we have a similar sort of loop back in information so that we can be using data there as well for prevention and investment efforts?
Last year was the first year that the probation department RAD team did a snapshot report on the adult system. And as you know, with departure of Dr. Child, and also we have several vacancies, we have not been able to do one for 2021 for the adult system. Our goal is to move forward and do a data book for the department as a whole once we're fully staffed.
Fantastic.
And to be able to share that data. You know, our quality assurance teams have reached out to Craig recently to get some more just general reports so that they can be driving their case plans and the work that they're doing with individual probation officers, ensuring that the services that we're looking at align with the case principal service needs.
Thank you. It really is, to me, an exemplary model that we should be using and modifying really for work that we do across so many different areas, so that we are investing in the right things and addressing the clearly defined challenges. Public Defender O'Neill.
Thank you. I just wanted to mention that one place where we sometimes get deeply detailed data on adults in the system is at the Community Corrections Partnership. There have been report outs there, and it seems like it should be at Public Safety as well. But there's often a really rich discussion about arrest trends and recidivism trends. So I think it'd be interesting to have it here as well.
Yeah, I agree. Let's see where that might fit into our work for next year. Thank you for that suggestion.
You know, just real quick, Chairperson, being able to look at the data this way really does allow us to see where the gaps are as well. And as you can see, and as you look further into that report, I mean, there are some gaps and where we as a county can really improve our services to certain areas in our county that maybe don't get quite as much. And so I think that's just being able to highlight that really helps this group here focus on areas where there are gaps that we can make improvements.
Yeah, I agree. And I'd like to give some thought to how we really particularly call out the gaps. They're in the report, but to really focus on 3 or 4 or 5 of them and say, how can we address these particular things, and set ourselves up with a committee goal for the next year. These comments are coming at a great time as we put together the work plan for next year and think about how we as a policy committee can truly be impactful. So I appreciate everybody's comments. Is there anything else? Are there public speakers? And I know, by the way, Camille, that I neglected to ask you to take a roll call vote on item 6. So let's do public's comment for item 7. There's no motion needed there. And then we'll go back and do the vote on item 6, for which I know we have a motion and a second.
Okay, very good. We do have one.
Okay. 2 minutes once again, please.
Thank you. Okay, our next speaker is Paul Soto. I am unmuting you. Please go ahead.
Yes, Paul Soto from the Horseshoe. I'm just glad that I'm alive and coherent to be able to hear these conversations about juvenile arrest. I think the last time I went to one of these meetings, there was no women, there was no girls in juvenile hall, and it was like 8 guys. I mean, this is just because I lived in a generation where there was hundreds of us. B1, B2, B3, B4, B5, B6. We had, excuse me, we had Preston, DeWitt Nelson, we had James Holden, this place was filled, and it's a racial issue, man. We were dogged out as Chicanos in the barrios because of these redlining policies. What we did as a society is we criminalized the symptoms of racism. That's what we did. Live with that. Sit with that. What we did in order to cover up the crimes against humanity, which racism is, because racism is a form of genocide, is that we criminalized the symptoms of the redlining policies so that we didn't have to, as a society, accept responsibility for those crimes, because we were criminalizing the people that were experiencing it. You see, by the 3rd grade, you can determine how many prison beds you're going to need to build. Why? Because these are schools that are in redlined areas. So one of the things that I would like to know is by zip code. See, you're not collecting the data by zip code. I want to know the zip codes of these kids. That's number 1. Number 2, has juvenile crime increased as a result of the decrease in arrest? Or does that mean that juvenile crime itself has gone down despite the fact that there's been less arrest? Because the Republican talking point is that, oh, well, if you stop arresting people, crime's going to go up. Well, I'd like to.
Our next speaker is Irvish. I am unmuting you. Please go ahead.
Thank you. Thank you, Board of Supervisors, as well as the respective county staff, county council, and as well as the respective commission members. First of all, I wanted to acknowledge the facts about what the previous speaker has said and what is required to be done as a part of a public safety and justice committee. What even becomes more important is that when any juvenile system decides or provides a judgment or decides a commissioning ruling and a policy, it becomes effective on the day it's being implemented and then being effective and delivered to the county. However, what becomes even more important is that we are the people who decides the factor of that, what is the prevalent crime that is within the specific county. First come first. when any particular person is being born, they are not being taught that, how to become a criminal. It's us who defines the policy. It's us who define the law. And it's us who decides that, what is the criteria to maintain that sanity and discipline as a part of a law and a policy that is being developed within the county. So what is even more important is that the county's job and the duty, they are being performed, but how much effective it is, that is to be determined. So by statistically, the law which is being applied, it clearly shows the county's result that how much the law is effective. When the law is not being implemented, when the policies are not being effective, we can clearly see the results that being foreseen. The incarcerated people, the gun violence, as well as the juvenile, which is deprived of certain services or not having the justice system provided. That's all part of a law that is required to be implemented, and that's something the county is working upon. So I acknowledge the facts about that is being outlined, but what is even more important is to acknowledge that what is not being done and what is required to be done. So thank you very much for consideration of comments, and sure, statistical data always helps. Please consider my comment in all caps.
And that concludes our request to speak.
Thanks, Camille. And will you take a vote, please, on item 6?
All right. Roll call vote for item 6. Vice Chairperson Wasserman
Yes.
and Chairperson Ellenberg.
Yes.
Thank you.
Thank you very much. Item 8 is a report on District Attorney Office and Public Defender Office and parity.
Good morning again, Chair Ellenberg. So you have a couple of different memos in front of you. So the administration prepared a legislative file for your review, and as did an attachment from the District Attorney's Office and also a memo from the Public Defender. We are happy to address any questions and talk about our recommendations in more detail. But before we did, I thought it might be prudent to offer our partners the opportunity to address their memos. This is a very important topic, and there's certainly opportunities and challenges with the parity study, but I didn't know how you'd like to approach it, if you'd like me to speak first, or the District Attorney or the Public Defender's Office.
Why don't we give the Public Defender's Office and the District Attorney's Office an opportunity to make high-level comments on whatever they'd like to really highlight from their reports, and then we'll go right to questions. Thank you.
Thank you.
Molly, go ahead.
Thank you. I'd be happy to jump in just briefly. And I wanted to, first of all, thank you, Chair Ellenberg and the CEO's office for undertaking this, beginning to undertake the study of this issue. I think it's gaining traction in California and across the country as we grapple with racial justice issues and try to ensure a level playing field in the criminal legal system and between DA's office and public defense offices. So it's it's not an apples to apples analysis. So you can't simply look at number of attorneys or number of full-time employees, nor can you look at one's budget versus the other without a lot of further conversation. However, it is pretty startling to notice that in general, in this county and in most places, prosecutor offices have generally double the budget that defense offices do, and usually about double the number of employees. And it's in those details that I think the work is going to be really important. The DA certainly does things that the Public Defender's Office does not do. They run a crime lab, for example, but we do things that the district attorneys doesn't do, that DA's offices don't do either. And I've outlined some of those in my memo. So I think it's going to be really important to kind of choose buckets of analysis, things that we both do, things that we do that they don't, and they do that we don't. And then areas where we both do the work, like investigation of cases, for example, but they're scaled differently. And then there are things, as I mentioned, like the DA has 2 senior press and communications staff. They have a full-time attorney doing research work. So I'd really like to kind of have that conversation in detail as we do the work. And I won't belabor the point, but I'm very excited about this conversation. I think it's really important to make sure we do in fact have a level playing field, and the resources that both offices are adequately resourced to do the work. And one final point I'd make is that criminal justice reforms over the last, really since 2011, when realignment came down, the amount of work and workload for both offices has increased tremendously, and that needs to be kind of taken into consideration as this conversation unfolds. So thank you again for having, for engaging in the work and having the CEO's office participate with us as we look into the details.
Thank you very much, Molly. Stacy, are you commenting for the district attorney?
Sure. I mean, I think our report was fairly thorough, but I agree with Molly that the DA's office looks forward to kind of participating in a look at our individual offices and the work that we do. And I think it's extremely important right now, given the fact that there has been an increase in violent crime and the courts are extremely impacted due to COVID, and all of us are feeling the burden of that with extremely increased caseloads and asking each of our offices to do different work than we've done in the past due to reforms. And so I think it's a great opportunity for us to sit down and collaboratively look at the issue, and we look forward to doing that.
Thank you very much. Sylvia.
Yes, thank you.
Please.
I'll just add that I do support the work that is being undertaken. I absolutely agree that the timing is excellent for it, because as Molly mentioned and Stacy has, that really the scope of the work of criminal justice partners has increased in scope for a lot of the legislative changes and challenges that the state legislature has imposed on us, and that if we are going to maintain the excellent quality of public service that our county has been very proud to provide in criminal justice, it's going to be unreasonable to continue to have those expectations, especially of defense counsel, without the adequate, fair, and reasonable compensation that is associated with it. So I think Chairperson Ellenberg, the timing of this couldn't be better. And as usual, we are setting the bar and starting the trend statewide, definitely, because these conversations are not happening in other jurisdictions and have not happened for years unless they've been sued for it. So we are ahead of the game.
I appreciate hearing that. Thank you. Are there other folks on the dais that want to comment here? If not, Supervisor Wasserman, go ahead.
Thank you. Yeah, I think it's I think it's a very, very interesting subject. I think the study, the analysis, looking for, I would say, parity for core criminal prosecution. That'll be an interesting study and analysis. I know there's private defense attorneys. I know there's the IDO panel. I know there's all these different factors that come in from both sides. I appreciate the graciousness of both the ADA and our public defender in the comments that were just made. I think it's going to be a very, 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 very in-depth, complex analysis that will take place over, I don't know what amount of time in the future. But I think at the end of the day, the proper representation, be it defense or prosecution from either side, equality for the individual being held, appearing, is what's most important. And I think everybody has good hearts and minds wanting to do that. I think it's extreme. I don't think it's apples to apples. I think there's so many things, and Public Defender O'Neill mentioned a little while ago, there's so many things and that each of the offices does, and to assign time and dollars to each of those tasks and chores, what does it really take to assign how many dollars are offset by individuals with private defense attorneys or that come from Sylvia's office? It's going to be a lot of work. And I look forward to reading about it in the paper.
Thank you very much, Supervisor Wasserman. I want to extend my appreciation to the county executive office and the public defender and the independent public defender and the district attorney for the work on this report. The idea of forming a work group to look at parity is very appealing, and I will make a motion to direct the creation of that group. And I'd like to ask that the work group look at a couple of things in addition to the scope that's described in the report, please. First, I'd like to see an analysis that includes the ratio of attorneys at each salary grade level. I can see from the report that the public defender's office has a higher proportion of grade level 1 and 2 attorneys than the district attorney's office, and a slightly larger proportion of ADAs are at the more experienced end of the spectrum in the district attorney's office. So teasing out the intentionality of this would be important, as well as helping the public better understand the makeup of each office. And second, I'd like the work group to review the budget of the district attorney's office and provide a recommendation on funding that should be included in a parity analysis, including funding that goes toward ancillary or supporting functions. I agree with my colleague that these are complex questions for the work group to evaluate. I think it will be interesting to see, perhaps several different models presented to us based on different sets of assumptions. And I don't want to put an artificial timeline right now on the report back because I don't have a sense of how long this will be, but certainly I am not interested in drawing this out because we need to always convert research to action as quickly as possible. And because the need is so great right now, I would like the work group to proceed with urgency to give us some answers and make the adjustments that we need to make sure that we are fairly representing and protecting the rights of every resident in our county who comes in contact with the system, as well as every person who is a victim of harm. Casey. Oh, let me get a second first on the direction.
I'll second for discussion, and then I have comments after Casey, please.
All right, thank you. Go ahead, Casey.
Thank you, Chairperson Ellenberg. We've set a very aggressive timeline for this work group and for the initial proposals. As everybody has mentioned, this is a complicated analysis, but one that is needed, and we will do our best to keep to that timeline, keeping in mind the importance of it and the level of detail that we will need. I did want to mention briefly, Public Defender O'Neill did make a request that we consider an independent consultant. Certainly at our initial meetings with the work group, I think this is something we'd be happy to entertain. My concern there is it could draw out the process. So I just wanted to note that for the group in case there was any additional discussion that you or potentially Public Defender O'Neill or Supervisor Wasserman would like to have on that point.
Happy to hear from them. My sense, I'm not the one doing the work, so I don't necessarily need to make the final determination, but I'm inclined to say let's keep this internal because it looks like we have a very broad range of perspectives and views. I don't feel concerned about the report out having some kind of bias absent an external player in this, but I would look to the district attorney's office and the public defender and independent public defender that if you feel very, very strongly that it needs to be somebody independent, we can certainly entertain that. Molly.
Yeah, thank you, Chair Ellenberg. I'm fine to have it remain in-house, but I do have some concerns about the aggressive timeline and about the scope of the work. So for me, it's way too important to jam it in, a constructed timeline that isn't actually in line with the amount of work that has to be done. And as far as the scope goes, I just want to make sure that all voices are heard about. And I realized that the ledge file was really a high level kind of commentary about the work, but there's a lot to it. And I think, to my point about 2 press officers, that's not going to come up in a how many attorneys do they have and how many attorneys do we have? So I really just want to make sure that.
Excuse me, Molly and Chair, I apologize. I need to step out for 60 seconds. I'll be right back. Molly, my apologies.
Thank you, Supervisor Wasserman. In any event, less concerned about the timeline, more concerned about the scope and everybody being heard about what the work looks like. And I think that will play out just fine in a work group where we have all the right people at the table.
Thank you. I would expect it to fall out organically as well. If it becomes apparent that a timeline isn't working, it certainly makes more sense to focus on quality and comprehensiveness of the work and the input, which again is why I don't want to impose a deadline. I know that all of you feel the urgency, and I think in fact that can move it along faster than an external consultant, while also having all of the safeguards in place because it's self-interested for all of these groups. So we will wait for, if there are no other comments, Supervisor Wasserman seconded for purposes of discussion and wants to say something else. So we will wait for him to come back. But in the meantime, do we have any public speakers on this item?
We do have one request to speak.
Okay,
Thank you.
great. Let's do 2 minutes, please.
Okay. Our next speaker is Paul Soto. I am unmuting you. Please go ahead.
Yes, Paul Soto from the Horseshoe. I'm looking forward to this discussion. I hope it's in a public forum, or I hope it's accessible to the public, because I want to be there. I want to hear these discussions, and I want to see the memos that are produced from it. Because you see, I have 35 years of experience in the criminal justice system. Okay, and so I know where the problems are, because I experienced it from my end. You see, we don't have any reports coming out of the public defender's office about tainted trials, stolen justice. You see, and I know every single one of you remembers that expose from the newspaper. So what I would like, so that we could use as a guide, use that. Tainted trials, stolen justice. I was locked up when these dudes were coming back. I know about Ben Fields. I know what he did. And I really don't, and with all due respect to the district attorney's office, I really don't think that you have removed from this idea of every single time we got to nail every single person that comes through our door and nail him to the wall and keep him locked up as much as possible, and then build a career on that. This is the same county that produced the 3 strikes you're outlaw. This county had the most convictions of any other county of the 58 counties. It was this county. Every other person inside San Quentin was from Santa Clara County. A bus filled with 32 people every Monday, Wednesday, and Friday for 15 years was on its way to San Quentin. Not because there was something wrong with us. There was something wrong with the district attorney's office and the lack of funding for the public defender's office. So I'm really looking forward to this conversation, and I would like the articles of tainted trials, stolen justice done by Karen DeSaw on the table.
And that concludes our request to speak.
Thank you. Mike, would you like to speak before or after I call
Yes.
Dr. Smith?
Thank you. If I can make a comment, please, I would appreciate it. What I'm trying to understand, Madam Chair, perhaps through County Council, I see Dr. Smith with his hand raised. What I'm trying to understand, excuse me. What I'm trying to understand is our committee here, are we suggesting this as a referral to the full board to establish a committee? Is it your intent to establish a committee and perhaps fund it, or a consultant through this subcommittee? I guess I need, through you, Madam Chair, to know from our county council staffing this meeting what it is we're able to do at this time.
Thank you for the question. Let me turn first to Dr. Smith, who I suspect may be answering that, and then to County Council. I see Kavita nodding as well. Go ahead, Dr. Smith.
Right. I was going to bring up some of the same subjects. If it's the intent of the subcommittee to create a Brown Act body, then it would have to go to the full board for
It
approval.
is not. It is not. The work group that is contemplated by the report seems like it's fully internal and not Brown Acted, not involving electeds on the committee. Is that correct, Casey? A correct reflection? I see Sylvia nodding as well. In fact, it's a work group that can happen without the board establishing it because they can simply get
Right.
together to do the work. So perhaps we don't need anything as formal as I had mentioned, but I'm interested to hear your further thoughts and from Casey as well, who I assume will be the coordinator for it if it happens. But
Yeah, you obviously stated the law correctly. If the board creates the commission, it's a Brown Act commission. If we just do it administratively, it's not. And if we do it administratively, obviously we would report out to the subcommittee on a regular basis what happened in the committee, the administrative committee.
Thanks. Then what I think I will do is revise the motion to ask for reports back to this committee as they are available from that work group.
Thank you.
Great. Thank you.
Thank you. Does that work for you, Supervisor Wasserman?
Yep. And I see Casey nodding her head too.
All right. Thank you all for helping me clarify that. So that is the motion. The second, we've done public speakers. Let's vote, please, Camille.
Okay. Vice Chairperson Wasserman
Yes.
and Chairperson Ellenberg.
Yes.
Thank you.
Terrific. If I am correct in skipping the items on consent, are we up to item 13?
That is correct. Item 13.
Perfect. This is the study on the high rates of grievances from Elmwood. And do we have a presentation or would we like to go right to questions?
Further question? Yeah.
Good afternoon. I'm sorry, good morning, Chairperson Ellenberg and Vice Chair Wasserman and esteemed members of the committee. I'm David Sepulveda, Assistant Sheriff of the Custody Operations. Here today with me to provide a brief overview of our item 13 is Laura McCabe from the Sheriff's Office Administration. We also have Captain Michelle Asbin and Lieutenant Nguyen from the Grievance Unit and Lieutenant Rita Rowland from the Elmwood's Women's Facility to answer any questions you might have regarding our item. Laura?
Fantastic. So why don't I invite Laura McCabe to make a few high-level remarks, not going through the whole report that we read, and then we'll go to questions.
Sure.
Thank you.
So, thank you. So we are very, very excited to be here today to talk about, this study that we're excited to perform. As you're aware, the quarterly grievance reports have shown high rates of grievances among women. And also we We recently had the gender needs assessment performed, and the gender needs assessment indicated that there are additional issues that need to be addressed. And so we have decided to perform a study in working with the Moss Group, who performed our gender needs assessment. The Moss Group hired a new individual who's going to be working with us. Her name is Hope Cooper, and she was the warden at the Topeka Correctional Facility for 5 years. She did a lot of work with the Department of Justice in avoiding a consent decree, and it has extensive experience in working with grievances and has done work within that agency, very similar to the work that we are looking to do now. So we're very excited to be working with her. And we've met with them several times. We first met with them to discuss the study itself, what we were looking for, and then we met with them to discuss the grievance unit itself, do an actual training on the grievance unit and our grievances overall. We provided them with a lot of documentation. The Moss Group is currently developing a proposal, so we don't have a lot of specifics to discuss. But what we did discuss with them is that they would like a history of grievances for the last 3 to 5 years. We know that this study is going to be very in-depth. They're going to come in, they're going to do focus groups. It's going to be a really extensive study, and we are looking forward to the results and to being able to make the changes that are necessary as a result. Thank you.
Thank you very much. And thank you as well for the report. Of course, we know that the disparity between men's and women's jail grievances has long been an issue to which we haven't yet, really found a satisfactory answer. And I want to recognize CCLAM for bringing the issue to the forefront with their recent report. I'm looking forward to hearing their report in PSJC in the new year. They have submitted it for review. I have just a couple of questions for the Sheriff's Office. it sounds like, and from Laura, your report sounds like we're still doing an investigation on the issue. Do you have a sense of when we might anticipate the Moss Group report, or at least the portion on grievances to be completed?
So they haven't started. They're developing a proposal right now. Once they come back with the proposal and we negotiate the different specs, for example, you mentioned the disparity. We want to be sure that that's included. So when we negotiate the specs, we can develop the timeline. So I would hope that sometime with the holidays coming up, maybe sometime in January, we'll be able to have some information.
Perfect, thank you. And would it be possible to incorporate the recommendation of the CCLEM committee, the CCLEM subcommittee chair, who suggested that men's grievances also be studied to explore whether any of the reason for the disparity may be that there are barriers to men filing grievances that women at Elmwood may not experience?
I think that would be a separate study, and I think that study would have to be done unit by unit. But I think this is a good place to start because we'll know how to perform the study, and then we can tweak it as is needed. Because in the men's is a little different in that we might have to go unit by unit because disparities might be different depending on the unit itself. So it's a much larger study and the grand scale of the men. So we'll start with the women, and then we'll work from there and figure out how to move forward from there. There's no reason we couldn't study the men. It's just that this is where we were starting because where it came up.
Right, I think that's a very fair point, and we may have sufficient data through that report to help us understand what we would even be looking for with the men to determine whether barriers exist or there are other reasons that the women are grieving more often. So that's good advice. Thank you. Are there other, Supervisor Wasserman, any comments on this item?
No, ma'am. Thank you.
I'm looking for raised hands on our dais. Not seeing. Camille, do we have public speakers on item 13?
We do have one request to speak.
All right, 2 minutes, please.
Okay, just 1 minute as we get the timer up. All right, our next speaker is Paul Soto. I am unmuting you. Please go ahead.
Yes, Paul Soto for the Horseshoe. The grievance process is a failure, and here's why. You have the same kind of grievance process, which is a 30-day time constraint. And guaranteed, you're not going to get that grievance back until the 29th day, and sometimes on the 30th day. Okay, that's number one, and that's it. That's across the board. For example, if I'm grieving a cop disrespecting me, and then I'm grieving a medical issue, the timeline is the same. But I'm asking this board, do you think that the timeline for the response of a grievance for a medically related issue and an argument with the cop should be on par? Is that okay? Do you think that that's okay? Because we already know that medical conditions can be exacerbated by time. So why is that? Why do we have this uniform way in which we answer grievances for 30 days? And then the answer that you get back is general and vague, and you get this back and forth that you just read a grievance. I don't know if any of you have read one. I've got 4 of them if you guys want them. I'll send them to your emails, okay? And I kept them. When from the jail, I kept them. I go, hey man, these guys don't know who they're dealing with. Because when I looked at it, I go, look at this. This is awful. I would hate to have a legitimate grievance, which in my estimation, at least 80% of them are. The other 20 are a bunch of complainers. But at least 80% of the grievances that are submitted are legitimate. And it's because of the conditions in the jail. And so until we get to this point to where we start understanding that medical grievances should have an expedited process, especially mental health, they should be seen within 5 days. And I mean, they should be answered within 5 days, and medical, the same.
Our next speaker is Irvish. I am unmuting you. Please go ahead.
Thank you very much, Board of Supervisors, county staff, and respective members of the commission. First of all, we tend to be relying on a data where we expect to see a results of forthcoming grievances. However, it is equally important to see and foresee that, what are the requirements that a jail facility would require, especially in terms of a women's facility. especially some of the work on a day-to-day basis for the incarcerated people that we wanted to foresee is that we wanted to isolate the number of people who actually require the requirement and accept the grievances. When a person within the facility generates the grievances, what becomes more important that under what condition that particular person has a requirement of that grievances. So medical issue, health issue, education, sports activity, as well as validating the fact about that whether that particular facilities person is required those facilitations or not. It's a very simple equation. Only a person who is qualified and having a validity and having that sort of education is able to rectify the need of that grievances. So the high rate of grievances can only be defined by what kind of inmate is there within the women's facility. So having study about that is equally important, which derives to the equation of that, what you are exactly providing the type of services in the facility. Please consider my comments that, on that rate of grievances that, you wanted to receive and type of grievances that you receive. That's the data that you want to see and also to understand statistically. And please consider my comments in terms of the district as well as state.
That concludes our speakers.
Thank you very much. Just a quick follow-up question to the sheriff's team. There are separate processes for medical grievances and non-medical grievances, correct?
You have that. You have the,
It's for unmuted.
Excuse me?
Chairperson Ellenberg, Captain Michelle Aspen. That is correct, Chairperson. All grievances that are submitted that are categorized under medical are forwarded to the medical, the business unit.
And are there different expectations in timeliness of response?
Yes, there are. If there are emergent issues, we do reach out to our medical partners to ensure that the medical needs and mental health needs of the inmates are triaged appropriately based on what is written in the grievance.
Thanks. Is somebody from Custody Health on here? Do we have Dr. Day or someone who might add anything?
Good morning, Chair Ellenberg and Supervisor Wasserman. Yes, that is correct. We just wanted to add to what Captain Asben said, but that they do identify emergent needs and those are triaged differently to be addressed immediately.
Thank you. Sylvia.
I guess my follow-up to that is, if that is the expectation, are those expectations articulated in a written memorandum format for employees to follow? Because I understand when we're dealing with staff and creating expectations for performance, there's a difference between what is written and articulated as an expectation for performance and what is sort of orally, sort of culturally, the norm. And I think, there's a lot of power in having written expectations that a medical grievance must and should be responded to within a certain time frame. And if it's not, then perhaps it should be, because otherwise, for example, if our staff, county staff personnel hasn't complied with it, there's very little we can do, right? Because there's not a written expectation, maybe there's an oral one, but it's a lot harder to enforce and or to seek disciplinary action if needed.
This is Lieutenant Jonah Nguyen from the grievance unit. So it's consistent with our policy directive and our training for grievances that contain mental health issues or medical issues. Our management analysts, they analyze and triage these grievances based on the content. And we do notate and make note of that in the internal notes of the grievances before we process them. So if we see that inmates has a crisis, that notate that in the grievance, we will call the unit directly, have the deputy of the unit check on the inmate, submit a mental health referral, document that before we even process that into the grievance tracking system. So then that way our business partners or custody health partners have documentation that actions were taken at onset so they can process and look into the grievance further for a meaningful response. Some follow-up might occur where the doctor might have to approve or other workflows that might trigger, but the initial welfare check of the inmate, they will be performed right when we receive the grievance or read any contact that require emergent issues or actions taken immediately.
And if I can add to that for 1 second, also, Assistant Sheriff Sepulveda, our policy requires that upon the receipt of the grievance that the supervisor or the management analyst who is getting it from the electronic system or the supervisor that's picking up a paper grievance from the grievance lockbox is required to take immediate action if the grievance has any type of emergent issue regarding medical, mental health, dental, or if there's like a threat, let's say the person feels threatened. So the policy requires them to take an immediate action before even processing any of the paperwork. They have to get involved at that point in time. So if the person says, you know, I haven't received my heart medicine in 3 days, then the supervisor will pull the inmate out immediately and get them to medical care immediately and notify medical. If the person says, I'm feeling suicidal, they will pull them out immediately and start the process of the evaluation. So that is part of our policy and our process.
Thank you.
Sorry, through the chair, just to add to all the responses, we'll be happy to add a paragraph to our next quarterly report to PSJC for medical grievances to address these specific concerns and to reiterate. I just want to reiterate what Lieutenant Nguyen and AS Sepulveda said about the triage process to ensure that medical grievances are responded to right away. I just want to remind everybody our providers are on site, eyes and ears, 24/7. We want to also remind everybody we do have that capacity. We continue to evaluate and assist patients on a regular basis. Thank you.
Thank you all for the additional information and responses. I very much appreciate that. We don't need a motion or a vote on this item. There's no direction. Item 16 is the opportunity for announcements, and I'm going to share two. The first is that yesterday the Board of Supervisors appointed presumptive sheriff-elect Bob Johnson as the interim sheriff pending the certification of the election and to serve as interim sheriff until he is formally sworn in January. And he will, of course, become a part of this committee, and I look forward to bringing him up to speed, having him meet with everybody on the work and becoming a vital voice in this group. As Sheriff Johnson joins us next month, that will be our first month in, I think, 12 years that Supervisor Wasserman will no longer be on the Public Safety and Justice Committee, and I want to acknowledge your very long dedication and commitment to the work of public safety and justice. I think you may have introduced yourself to me as the law and order guy. And while we have had significantly different approaches at times to the work of this committee, I have always been appreciative of your perspective and your view and your willingness to dig into the issues and do what is absolutely the best and most important for our community, whether it's our county employees, in particular the sheriff's deputies and the correctional officers, or the people that come into contact with the public safety and justice system. So thank you very much for your service. It has been a pleasure serving with you.
Thank you. Public safety has been first and foremost from day one. Thank you very much.
Got it. Thank you. Are there any other comments or announcements from anyone else? Deputy Chief Burchard?
Yes, just real quick, either tomorrow or Monday, but I think tomorrow, and this is something that you all are aware of in the Board of Supervisors meeting, that we have a Narcan vending machine that will become operational in our juvenile court services lobby for parents and youth who happen to come in. So we're really excited about that and working with our partners at Custody Health and Behavioral Health and Public Health. It was really a collaborative effort to get that up and operational. So can't wait to report on that and how that's going in the future.
Congratulations. Thank you for providing that unfortunately critical service.
Thank you. If I may just say goodbye and thank you to everybody who served on this committee that's here now. Thank you for your passion for the people of Santa Clara County. That's what's the most important thing, is that all of you care and all of you are experts in your field. I think we have the greatest combined team in the United States, but it's your knowledge and your passion. And I don't think you can do a great job without having both. So thank you all very, very much. Best holiday wishes and good health.
Thank you very much. We'll give the supervisor the last word and we will adjourn item 18 to the next regular meeting on January 10th, 2022 at 10 a.m. It is expected to be in the board chambers, and the expected new vice chair will be Supervisor Cindy Chavez. So happy holidays. Have a safe, meaningful, and hopefully restful break. And we'll be back at it in January. Take care, everyone.
Thank you.
Bye, everyone.
This meeting has been adjourned and we will now close this meeting. Thank you all.